Good afternoon, and welcome to Generations United's Learning Network webinar, Hunger and Nutrition Across the Generations. My name is Sherry Steinig. I am Deputy Executive Director here at Generations United, and I will be the moderator for today's session, joined by Leah Bradley, Generations United Program Specialist. Generations United works to improve the lives of children, youth, and older people through intergenerational practice and public policies. We share resources and connect practitioners around the U.S. and the world. One of the ways that we do that is through our website, which is at www.gu.org, e-newsletters, and these webinars. This is the third webinar in our current series on intergenerational issues made possible with a grant from MetLife Foundation. We will continue monthly webinars through April of next year. Please watch the calendar on our website or our e-newsletter for more information on upcoming learning and networking opportunities. Before I turn it over to our presenters, I wanted to quickly go over a couple of additional housekeeping items. We have experienced some challenges with this system during past webinars. I wanted to alert you that there may be a delay when moving through the slides. Our speakers will keep going and the slides will eventually catch up. If you're having difficulty hearing, there are two options. You can either listen through the phone or through your computer speakers. So if one's not working, we recommend trying the other. And you can get that information on how to dial in through the audio tab. There will be time for your questions and comments, so please use the question or chat function to ask them at any time. The questions will come to me, and we will be sure to ask some of our presenters. The webinar is being recorded, so this recording, as well as the PowerPoint slides, will be available on the Generations United website, and the link is on the screen to where you'll be able to find it. The PowerPoint slides are currently up there with all the links to the resources that are shared. The webinar will go up hopefully this afternoon or tomorrow morning. Finally, just please take a few minutes to complete the short survey you see when you leave the webinar. We rely on your feedback and comments to plan future webinars. So I wanted to take a second and introduce our speakers today. We're thrilled to have Kim Caldwell and Jaia Peterson joining us today. Kim Caldwell is the No Kid Hungry Program Manager at Share Our Strengths. She joined the Center for Best Practices at Share Our Strengths in 2011 after completing her master's in public service at the Clinton School of Public Service in Little Rock, Arkansas. There she worked with the No Kid Hungry campaign Arkansas to design and complete a community assessment that mapped resources to end hunger throughout the state. Prior to attending the Clinton School, Kim spent 4 years at Green Lights for Nonprofit Success, a management support organization in Austin, Texas. As a consultant, she worked on capacity building projects for local nonprofits and created new resources for board development. Kim has served many roles on the national board of Young Nonprofit Professionals Network, including treasurer, vice chair, and interim chair. Jaia Peterson-Lent, my colleague here at Generations United, is a deputy executive director. Her work here includes leading the policy work of the organization, overseeing the work of our National Center on Grand Families, providing direction to our Seniors for Kids initiative, which engages older adults in support of quality early childhood programs, and overseeing the development of our signature report, this year's, which is featured in this webinar. Jaia is a leading expert on intergenerational public policies and programs and issues related to grandparents raising grandchildren. Under her leadership, the Legacy Housing Bill for Grandparents Raising Grandchildren was passed, and new multi-generational civic engagement programs were authorized in the Older Americans Act. Jaia received her Master's of Social Work from Syracuse University. She's a licensed social worker who has worked in child protective services, refugee resettlement, and in many other capacities with individuals and families from a variety of cultural backgrounds. I'm now going to turn the presentation over to Jaia.
Thanks, Sherry. And we thought, obviously you all are somewhat familiar with Generations United as you registered for this webinar, but we wanted to start by just giving a little bit of background about Generations United, and then when Kim starts, she'll give some overview of Share Our Strengths work. So Generations United was founded in the mid-1980s when you had some images like what you're seeing on the screen in the media. You had aging advocates and children's advocates, and the impression was that they were, faced backwards, fully flanked with weapons. They were going to walk 10 paces, turn around, shoot, and the last one standing gets the resources. And the sense from Generations United is this is not a good frame for advocating for children and seniors groups, and so a number of organizations came together to found us to find common ground between aging and children's groups, look for ways that older and younger can mutually benefit each other. And from there, Generations United was founded as a loose coalition and eventually founded as our own nonprofit in the mid-1980s. Our founders are Child Welfare League, National Council on Aging, Children's Defense Fund, and AARP. So that's a little bit about where we've come from. We take a two-prong approach to promoting intergenerational connections, both through our policy work, advocacy, public policy work on Capitol Hill, and also through promoting intergenerational programs, providing information and resources to help groups that are making programs operate them, or operating programs operate them more effectively and efficiently. So that's a little about who we are. About 3 years ago, we started issuing an annual signature report, and the topic of that report is chosen from gathering information about what we're hearing from our network, recommendations from our board about what really are the key critical intergenerational issues that they're hearing come out in their network and in the communities in which they work with. And a year ago, as we started having this discussion, it was very clear as we were talking to our network that just the basic realities of hunger and nutrition challenges facing children and seniors were real and needed to be looked at with another lens. There's a number of terrific organizations, Share Our Strength certainly being a great partner in this area, that do a lot of work on hunger for children and for older adults. What we wanted to do that we thought was missing and would be a unique piece is really look at what are the intergenerational solutions. How can we engage our younger and older people in finding solutions to address hunger and nutrition challenges facing our older and younger people. So that's the focus of this report. We know a little bit about the numbers out there. So what is the reality of hunger, or the language often used today is food insecurity in the country today, and Kim will talk a little bit more about what that means. What we know is that 1 in 5 children and 1 in 12 older adults are at risk of hunger in the U.S. today. So we have this image here. When you're looking at a room full of people, this is the number of folks that you might see that are actually at risk of hunger at a given cross-section of America of older and younger people. When you look at a larger measure, just so you get a sense, there are a number of older adults that are very close, sort of at the next level of hunger, where you have 1 in 7 older adults that at times are anxious about whether or not they have enough food. So while it's 1 in 12 older adults sort of at the next level in expanded measure, there are a significant number that are very close to that, and even more children fall into that more expanded measure category. So that just gives you sort of the broad scope at what the numbers are in the U.S. What Generations United wanted to do is take a look, delve a little more deeply into what does it mean in terms of anxiety around food for children and seniors in the U.S. So we worked with Harris Interactive to conduct a national study of adults over 18 to ask some questions about their experiences with food and nutrition issues. And here are some of the highlights. We saw that 1 in 3, nearly 1 in 3 adults had experience or concern with food among themselves, family members, friends, or neighbors. So this means that, of course, we have about 200 people registered for this webinar. 66 of us, potentially, if this is a perfect cross-section of America, have someone that we know or we ourselves might have concern with that. It's a significant number. Drilling down a little farther, the reality is that we have adults that are actually going without some basic needs to meet the needs of a family member. 1 in 10 reported that they were going out without a basic need such as food, medicine, or health care in order to provide food for another family member. This is an issue. We do a lot of work with grandparents raising grandchildren. We often hear stories about those grandfamilies actually holding back on their medication in order to meet the needs of grandchildren, for example. So that would be one example of this population. We also took a look at, of those that responded that said they did need to seek food assistance or received food assistance, where were they getting it? Overwhelmingly, we saw that nearly 3/4 of people that responded to this were getting assistance from the government. So the government is a critical source of assistance when it comes to food security. But in addition to that, certainly families in need rely on other family members. So we had 53% that look to another family member. And then there's also other sources. Food banks are huge, a significant source of support for families. Churches and houses of worship, 38%. 35% relied on a neighbor or a friend. And then very interestingly, we really saw that community gardens are a growing source of support and a place that people look for assistance when they need help from non-traditional means. And then I think the other critical piece is we saw that government support is a very important source of support for families that need food assistance. Not only is it an important source of support, but people think that it should be there for people when they need it. So the survey showed that 70% of U.S. adults agreed that policymakers should prevent cuts to existing federal food programs for children, youth, and older adults. And this is a particularly critical statistic, I think, in this environment when Congress is having conversations about potential across-the-board cuts or targeted cuts to address our current budget situation, the fiscal cliff, so to speak. And then finally, we asked questions about, so even if you have the resources, what are the unique needs that children and seniors have when it comes to nutrition? Do you know what they are, and would you know where to go to get information about what are sort of the special nutritional needs of this population? And we found that nearly 1/4 of respondents actually didn't have that information, that didn't believe they had access to that information. So we need to do better about getting information out about the special nutritional needs of children, youth, and older adults. So that's just a quick wrap-up of some of the highlights of the poll data from our report. There's more information in the report itself, and you have a link. It's right on the front of our website. I'll be referring to it again later in this presentation. But we wanted to set that stage, and then I'm going to turn it over to Kim to talk a little bit about some of the work Share Our Strength is doing and really what hunger's impact is on people that are affected by it. And then I'll talk a little bit more after that about some recommendations and program models along with Kim. Kim?
Thanks so much. Hi again, I'm Kim Caldwell with Share Our Strength, and I work in our Center for Best Practices. And the center is really focused on looking at all the efforts that are taking place across the country to end childhood hunger and looking at what's working so we can share and help folks replicate those models. And we work mostly with No Kid Hungry campaigns, which use the systemic change model you see above, which is all about reaching kids where they live, learn, and play. And so we're focused on increasing access to school breakfast by changing the way breakfast is served in our schools, making sure that during the summer when school's out that there are more ways for kids to access meals during the summer and get snacks or meals at school as well, because we know many kids have their last meal at lunch. And then really making sure that SNAP and WIC and then nutrition education are part of the conversation as well, so that you're increasing the resources for the entire family, and not only increasing the resources, but the know-how on what to do with those resources. And we at Share Our Strength really focus on leveraging federal nutrition programs, and so we know that there is right now, as Jaia mentioned, a great network of food banks and groups that are out there providing that emergency food assistance. But what we want to do is make sure that the systems that are in place to protect our kids and make sure they have access to food are working as effectively as they can. Next slide. And so the No Kid Hungry model is really set up around access, education, and awareness. And so as I said previously, we're really focused on the nutrition programs that exist because there are dollars put behind that. And if we can just help those dollars turn into food for kids, then the system can be more sustainable and continue to reach those in need. And so we work through a state-based model where we bring together local leaders, statewide leaders, and the organizations that are already doing this work so well, and provide more resources to help them move the numbers on access. We focus on education largely with our nutrition education program, which Cooking Matters, we'll talk more about that later, but making sure that when you have food, that one, you're getting the most nutritious food, and two, you know how to make that food, make those food dollars work for you the most effective way they can. And then awareness. We talk about making sure that ending hunger is a national priority. Like Jaia mentioned, you know, there are cuts right now being talked about to SNAP, and how can we help make sure that that ending hunger is enough of a priority to make it impossible to make those kinds of cuts. And so that's our approach. So, so next slide. Jaia mentioned earlier the term food insecurity, and I'm just going to touch on that quickly. So food insecurity is an economic state in which a family does not have the resources they need at some point during the year to provide the food they would like to for their family, and so they're missing meals, and it really is considered an economic state. And that's kind of the way that we talk about the hunger statistics when it comes to the numbers. And so but when you talk about the state of hunger and what being in that state causes, that's when you start to see the types of consequences that we have listed here. And so there's research showing that kids who are suffering from hunger are less likely to attend as much school as their counterparts at any income level that are not suffering from hunger. And that when you are in a state of hunger, it decreases your ability to participate in school and to concentrate, and leads to more tardiness and absenteeism. And so it does impact the ability to participate in your education. And what we also know is that educational achievement is tied to economic performance. And so as we have kids who are hungry, they are less able in life to achieve the economic outcomes as their counterparts who are not hungry. And the health consequences, you know, health problems such as weight loss, fatigue, headaches, they're pretty substantial, and they also can start young and have increased effects over time. And so, you know, you see that hunger can affect the development with the cognitive development of children, and undernutrition can affect a child throughout their life. With a note about national security, the school lunch program was actually started originally because kids were not receiving the nutrition they need, and it became a way to make sure that we were raising children that were able to serve their country. And so continuing to make sure that the health of our children and the access to food is a priority is a concern. But then the last piece I want to touch on is obesity, and that's one of the ones that you hear people say, oh, no, our kids aren't hungry, our kids are fat. And those two things we really talk about as being two sides of the same coin. Like I talked about, poor access to nutrition early on can lead to health effects such as obesity. And so when kids have access to the wrong nutrients or they're lacking nutrients early on, it can lead to obesity. And so as counterintuitive as it may seem, making sure that kids have access to consistent food and to healthy food is actually a tactic to address obesity in our country.
Great, and I'll just build on that to talk a little bit about impacts on older adults, since Kim's focused on the children in particular. A couple key pieces of information is certainly improved nutrition when it comes to older adults improves memory. It helps them maintain physical activity, and there's actually research that shows that it reduces the number of trips to the doctor. And we have some advocates here that talk about, possibly promoting this concept of having doctors write prescriptions for good nutrition on a prescription pad, because it's such a critical element in improving and maintaining health of all people and older adults in particular. So there's a range of impacts for both children and older adults. I'm going to move a little bit to some of the key recommendations from our report. We're obviously limited in time, so we can't talk about the full range of challenges that are facing older adults and children in the U.S. You can look to the report to get some of those details, to sort of delve more deeply into some of the impact pieces that Kim was highlighting. But we want to move to solutions as quickly as possible and talk particularly about those intergenerational solutions. The report has a wealth of recommendations in it, a long list of recommendations, many of them detailed. What I tried to do is sort of drill them down into 4 primary areas to focus on for the purposes of this discussion. And the first is currently, certainly in the midst of these fiscal cliff and budget deficit discussions, we need to really be thinking about priorities and what's going to be helping our economy and positioning us for the future as a nation and protecting our children and seniors. And cuts to nutritional programs are not the thing to be doing right now. So a key recommendation is protecting and strengthening those federal food programs and income supports for children, youth, and older adults. So in particular, we often highlight what's referred to as SNAP, the Supplemental Nutrition Assistance Program, also known as food stamps, which Kim has referred to, really is a critical piece. And what we know is that actually investments in staff have a multiplying effect in the economy. When people get money through the SNAP program, they spend it because it can only be spent on food. So that in turn stimulates the economy. So we actually have research that says that for each dollar a beneficiary spends on SNAP, it yields $1.79 for the local economy. So not only is it good for the immediate people that benefit, but it has a multiplying effect for the economy. It just doesn't make sense to be cutting these programs right now. That's one key piece. The second piece is we need to be making it easier for children, families, and older adults to get healthy food. So there's this concept out there of what's described as food deserts. So we have places in communities where there may be food, but it may only be corner stores that don't have fresh produce. There may not be, outside the city of Philadelphia, there's a community called Chester that's been without an actual grocery store in 11 years, and they're just now opening up a nonprofit grocery store, a new model, to provide fresh produce to their community members, and that's a model that's being supported by their members of Congress. We need to be looking at models like that and creative ways to get nutritious food in communities. There's a model that's promoted out of DC Central Kitchens. Robert Egger has been pushing a model called the Stock Box Grocery, which is actually a large shipping container. I think it's 24 by 12 foot shipping container that actually ships to a local community, plop down, and it's open, and there you have a little mini grocery store with fresh fruits and vegetables ready to go. So what can we do to be promoting more models like that in areas that don't have the type of nutritional food that's needed? So what can we do to make that easier? In addition, our federal programs need to be providing enough resources that people can actually use SNAP, use the federal support to buy the more expensive produce versus those sort of boxed items that might not have as much nutritional value. So we have to have adequate resources in our federal programs in addition to local community solutions. The other key piece is engaging the business community and helping to address hunger in communities where they serve. And this is important, one, in finding ways to communicate with businesses that not only is it the right thing to do, but businesses are increasingly recognizing that consumers are looking for ways in which they're socially responsible and giving back to their community. So it actually, helps company image to be demonstrating how supportive they are to their community. And certainly, meeting basic needs is something that absolutely resonates with people. In addition to that, offering simple ways that businesses can be supportive, from matching employee donations to food programs to encouraging, say, a farmer's market to open right outside their company so that it's easy for their employees to get fresh fruits and vegetables right when they're leaving work. So there's a range of suggestions in the report to how to engage the business community in promoting health, addressing hunger, and promoting healthy eating. And then finally, promoting intergenerational approaches to meal programs and services, and that's the big one. And we want to just spend a little bit of time talking about, some examples of what that could mean. When we talk about intergenerational approaches to meeting nutrition and hunger needs, what do we mean? What's unique about this model? Well, for one, we're looking at models that actually engage younger and older people in tackling the issues that are facing them. So not only are we saying that hunger and nutrition challenges are those faced by younger and older people, but we can engage them in addressing them. That's what an intergenerational model does. It views people of different generations as supports to each other. So they're supports to the community, and they can actually be resources and supports to each other. It also recasts that sort of single-age approach, which is a traditional approach. We tend to approach issues often sort of segmented by age in our society, to really look at ways that we can integrate them not only to address hunger across the generations, but also to stimulate learning, strengthen communities, and save money. So I'll talk about this specifically in some of the examples, but say we have a program that engages, that's at a retiring care community that engages kids from the local school in a farm, farming in a community garden, and then those kids work with the older adults to sell the products that they make. Kids are not only learning about how to grow vegetables, what kind of vegetables are healthy, but they're also beginning to learn entrepreneurial skills, how to sell the produce, how to market it to the community. So it's a way of learning. It sort of stimulates learning in addition to meeting some of the basic food needs. They strengthen communities. We'll talk about models that address isolation among the older adult population, that sort of positions young people to be leaders in their communities. And finally, they save money. So we actually do have some research that shows, for example, joint meal programs, programs that serve younger and older people under the same roof can save dollars by saving money on rent and staff time, for example. So it's also sort of resource smart in that way. And then finally, I've touched on this, but these programs cultivate leadership qualities that we know exist in people of all ages, and they really hone those qualities so that we can look at our younger and older members as leaders in our communities at addressing these challenges. So those are key components of the intergenerational approaches to nutrition, and I'm just going to give 3 quick examples that are highlighted in the report. One is a program called Meal Runners, and this program operates out of St. Louis, Missouri, and it started. It's a Meals on Wheels program where you have volunteers that deliver meals to older adults that are home and can't get out to get the food that they need. It started. The intergenerational concept started when we had the leader of the program noticing that she had. Most of her volunteers were older, and her older volunteers were actually struggling to lift the heavy carriers and coolers that had the food to bring to the folks at home that needed the food. And in passing a friend to her, the friend said to her, it's too bad we can't have the kids deliver the meals. And a light kind of went off, and she said, that's a good thought. And from that developed a partnership with a local high school where the high school students deliver the meals in exchange for school credit. And it's now actually in the 7th year, and you have teams of older adults and children that together deliver the meals to the folks at home. And I'm just going to tell one quick story about an older adult at home that was the recipient of some of the meals. Her name was Miss Lola, and her younger volunteer had gone to her home a number of times and had just noticed that she would come to the door, but the shades were drawn, and she was sort of disheveled. Her hair was in disarray. She was wearing her bathrobe. But each time she would come and she'd have a little conversation with her and drop off her meal. Next time, same thing. And one particular time she came to deliver the food to Miss Lola, and she just seemed particularly down, and so the volunteer said, you know, Miss Lola, would you mind if I gave you a hug? And so the two embraced, and it actually, Miss Lola ended up crying, and the two of them ended up in tears. And it really sparked something for her where she felt a connection that she hadn't had in a long time. And the volunteer found that from the next time on, when she went there, Miss Lola was up, dressed, ready to go. Her hair was brushed, and she felt like it mattered that somebody was coming to visit her and wanted to see her, and it really was a turning point for her. So what we saw is not only was the food and nutrition need being met, but there was a transformational effect in terms of isolation and Miss Lola's feeling cared about and ability to function in the community. There's another model I'll talk about called 5 and Fit in Philadelphia. And this engages older adult caregivers who surround children and parents really to shape their relationship with food. And this program is operated out of Temple's Intergenerational Center through a partnership with their Center for Obesity Research and Education. So it's particularly focused on young children that are overweight. And it pairs older adults with families that have children that need to reshape their relationship with food. And one story from this is particularly there was a young person in the program, Precious, who came in, when she came into the program, was eating potato chips and soft drinks for breakfast, and was paired with an older adult volunteer. And they have a number of different activities where they learn about different fruits and vegetables and that kind of thing. And after by the end of the program, the older volunteer said, I couldn't get her to stop following me around asking me for kiwi. And at home, she was asking for fruits and vegetables, too. And she also said that when she went to the grocery store with her mom was in the middle of the grocery store where all the boxed stuff is. And she said, Mom, we got to go to the outside of the grocery store where the fruits and vegetables and the good stuff is. So she was starting to communicate those messages back to her family as well. And finally, I'll highlight a model out of DC. DC's Central Kitchen, which is a long-running program that does a range of food programs locally here. I'm going to highlight one particular piece of it called the Campus Kitchen Project. And this project emerged when the director of the founder of the program noticed two phenomena. One, approaching the aging of America, and the other, the renewed interest in community service among youth, sort of service learning programs in schools. And he said there's got to be a connection here. This seems like an opportunity both to meet the food needs of this growing population of older adults, but also to connect with them and meet sort of their spiritual and isolation needs as well. And it also gives an opportunity for kids to learn entrepreneurial skills and gain some leadership. So what it does is it gives opportunities for schools. It functions in both high schools, colleges, and universities to use campus cafeterias or do a range of food delivery programs where the students themselves actually lead the process. They plan the menus, they run cooking shifts, they organize drivers, they do gardening, they teach nutrition education, particularly to older adults that are using the services of the DC Central Kitchen. And this model has been expanded beyond DC. It's in 33 high schools, colleges, and universities across the country, and it looks, a variety of ways in a variety of different communities. But again, a model that provides opportunities for meeting the nutrition needs, not just to do that, but to present a time or an opportunity for those participating to learn, creates those nutrition sites as learning laboratories, skill-building centers for all those that participate. So those are the examples, a couple examples from the report, and then I'll turn it over to Kim. I think you have a couple of examples from your network that you wanted to share.
Yes, and actually the first example is from our network, as well as featured in the report from the New Mexico Collaboration to End Hunger. As I had mentioned earlier, summer is a particularly vulnerable time for kids and hunger because low-income students who access the National School Lunch and National School Breakfast program during the school year are no longer able to get those foods. And so, as many of you may be aware, there is a program that exists to help community sites and low-income areas provide meals in a congregate form to kids. And so it's you don't have to sign up. You just show up, and because you're in that low-income area, you can have access to a free lunch or breakfast, depending on what's being served. And so, one of my colleagues who was in New Mexico helped to pilot some programs. They started with 4 in 2007 and ended up with 64 by 2011. And these intergenerational summer food programs provided breakfast and lunch through that summer program. And they brought in senior volunteers to help package those lunches. But what they also did was they provided grants to plant gardens and provide programming so that seniors, many from the Native American community, could come in and have this space to share their talents and experiences from dance, cooking healthy foods, and to crafts and other outdoor activities. And so it really was a great way to make sure that not only were kids and seniors in the same space, but there was a great way to interact. And many of the sites provided free lunches as well for the seniors. Some charged a small amount. But one of the important things to note as well is that one of the key things that helps kids show up during the summer to get access to food, because it's not as immediate as a school program, is having activities. And so that is, again, a great way to leverage the resources of the community and older folks to help provide programming. And so, again, looking at summer in Arkansas, this was a few years back. One of the community organizations that held evening meals, which is not as common as a meal to provide in the summer to kids. Most organizations provide lunch. They were able to also leverage TANF funds to be able to provide full family meals. And again, we know that is a barrier to participation during the summer as well, is that kids come to the site and they have food, but their parents don't. And so they have to sit and eat and watch their parents not eat, and it's not a very natural or family experience. And so they were able to use TANF funds to make meals available to everyone and get them all subsidized. And then because it worked so well and they had such great participation and great programming, Share Our Strength provided a grant this year to help continue the program when those specific TANF funds were no longer available. And then our Cooking Matters program, our Cooking Matters program is our flagship program. It used to be known as Project Frontline, for those of you who might be familiar with it. But it's really about nutrition and food skills and making sure that families have the information they need to live healthier lives with the food that's available. And we do this course with just children, with just adults, with daycare providers as well, but then we also have a class that's for families. And so there are about 800 adults and a little more, about 800, 900 kids that graduated through this program last year. And what we found is that it's a great way for parents to get the cooking skills, and for kids to get introduced to types of food that are higher nutrients, prepared in ways that are healthier. And so what our Cooking Matters team has found is that often with Cooking Matters for Families classes, and especially in areas of greater poverty, that it's grandparents who end up bringing their kids. And so it ends up being a situation where there's multi-generational households, and kids and their grandparents have a chance to do this activity together and learn together, and then they all have the skills they need afterwards to continue to eat in a healthier way. Great. So one of the pieces of the recommendation that Jaia had put together had to do with better leveraging federal nutrition programs. And so, there's the need at the top to make sure that the programs don't go away, but there's also the continued need to make sure that the programs are doing everything they can to meet kids where they live, learn, and play. And so this is some information about how to learn more about the programs. And so if you're providing programming, or if you're just even located in a low-income area, you have the opportunity to help provide access to food to kids during the summer through the summer food service program. And so there's more information there. There's also opportunities through the Child and Adult Care Food Program to provide subsidized meals to children and adults. And then one of the again, the issue with SNAP, formerly known as food stamps, is that right now it's estimated that only about 33% of eligible seniors are participating in the program. And there are a lot of reasons why seniors may choose to participate or not to participate, but providing outreach and helping make sure that everyone knows the program's available to them if they meet the requirements, and in many ways there are a lot of pre-screening tools to answer those questions on site. There's just a great opportunity there to increase, even in an incremental amount, the food resources available to seniors in particular, as well as families generally. And then we didn't talk a lot about the school breakfast program because it relates mostly to children, but there is increased opportunity there as well to make sure that kids are starting their day with a healthy meal by serving breakfast in a way that matches how kids live their lives today. And so all of these programs are federal programs that are managed at the state level through a state agency. And so there's a list there as well to learn more about which agency manages which program in your area. And so if you are interested in learning more or want to start conversations or are currently providing meals and programming and not getting the meals subsidized, I encourage you to learn more about what the options are.
And I'll just build on that, Kim, a little bit. This is a really helpful summary of some of the opportunities in terms of federal programs that are available at the local level. The report actually includes a chart of a number of federal programs, and it talks about potential for intergenerational opportunities in those programs. Some of it is suggestions for how Congress could moderate the change the program a little bit to make it more intergenerational. But a number of the suggestions are just ways that you could engage, for example, older adults as resources to kids in tutoring or connecting with kids while they're eating school breakfast. So there's a number of suggestions for, with existing programs, what you could do in your community to make them intergenerational models. So you can look for some of those examples in the report, which is linked at the homepage of our website.
Definitely, and I think one of the programs to point out, the At-Risk After School Meals program is one of the newest programs, and it has a 2-hour enrichment requirement, and so that is a great opportunity to engage folks of all generations there as well. So just a little bit of information about how you can learn more about us. The Center for Best Practices has a website, and we, again, try to bring together a lot of information about what's working with increasing access to nutrition programs. Our Cooking Matters program that I spoke about, not only do they work through local community partners, but there are a lot of great resources on the website as well to incorporate their curriculum into anything you're already doing. And then finally, there are No Kid Hungry campaigns or allied programs in, I believe, 30 states, and we're expanding further. And so there's a link where if you'd like to connect to the resources that are already being leveraged in your area, that is where you can find out more.
Great. Thanks, Kim. And I know that some folks have joined us since we began, and if you do have questions, please feel free to use the question function on the GoToWebinar screen to ask your questions of Jaia, Kim, or any comments that you might have. We are also recording this presentation, so it will be available on the Generations United website, as well as this presentation is currently available. The PowerPoints are already up on our website right now. I wanted to briefly, just in addition to the report, which was featured earlier and is prominently featured on the homepage of www.gu.org, some other resources available from Generations United. We'd like to alert everyone that our biennial conference is coming up in 2013, so to save the date for that, July 30th to August 2nd, it'll be here in Washington, D.C. It's an international, intergenerational conference that we hold every other year. Also, that many of you probably learned about this webinar through our weekly e-alert Generations This Week, but if you don't, that is where we share information about any new resources we have developed, training opportunities, and funding alerts that we may have heard about. You can also connect with us on Facebook, Twitter, and YouTube. YouTube is where we share all of the recordings of our webinars, so they're up there as well, and news and updates from those other social media sources are available. So we did get a couple of questions that came in for our audience, and please keep sending them in if you have more. So I just have a question, I guess both for Kim or Jaia. So in addition to the community outreach for SNAP, is there anything else that I can do on the policy front to support SNAP and other food programs nationally?
I mean, I can sort of speak to that from a policy advocacy perspective real quickly. You know, a number of you may have new members of Congress that are coming on board, or you may have existing members of Congress that you have a relationship with. They are in the process of making critical decisions and will be casting votes on budget decision issues. So it's important to be contacting them and saying that you believe that we should be protecting SNAP and federal food programs in these discussions. And in particular, with SNAP, you can talk about how $1 invested you know, produces $1.79 in return for the local economy. That's a really key sort of growth piece, and that's what they're looking at right now. So that's a simple action step in terms of advocacy.
And from the Share Our Strength perspective, we have a website, protectsnap.org, and there are just kind of a number of additional resources there. We've tried to create a lot of pieces to help reconnect members of Congress with the stories and of families on SNAP, and so it's not just billions of dollars. It's the stories of families who've made it through a tough time because of SNAP. But there are definitely efforts to be a part of, to add your voice to in other areas as well.
Thanks. And I think this question is probably for Jaia. So do we know what accounts for the difference in numbers for kids and older people and how they're impacted by hunger?
Sure. Well, I think there's two simple answers, although it's a complex question to this question. One is we're not very good at thinking long-term and making investments for kids. So we need to be better at supporting children, making investments in children, and that comes down to some of those very fundamental pieces like making sure that they have enough food to eat. I think in terms of the older adult numbers, older adult poverty and hunger numbers looked much worse many, many years ago. We took some significant actions to address one of them. One of the biggest impacts on older adult poverty in particular was creating Social Security program. So that's a really critical program, and you hear a lot about the importance of protecting that program. It does help children as well. It's a social insurance program for children as well, but provides for the immediate needs of all older adults that contribute through their employment. So that is a critical piece that's been helpful to older adults. But I think it's also important to recognize that while the older adult numbers look a little better right now, there are some that are really close to facing very real hunger needs. And part of the challenges that older adults face is that a lot of their income is tied up in their homes. So while they may look like they have more resources, if you're coming down to a hunger issue, you can't eat a shingle if your money is tied up in your home. So we have to keep that in mind as home situations are volatile and changing. In addition to that, as we're looking at the aging of the baby boomer population, one of the things we know is that a lot of older adults, traditionally older adults, have looked to senior center models to get help with food. They've gone to food programs at senior centers, and those types of models are not drawing in the baby boomer population in the same way. It doesn't mean that we won't have baby boomers that have hunger needs, but they might not be drawn to the traditional approaches to meeting those hunger needs, such as mass meal programs at senior centers. So we need to be thinking creatively, and certainly the senior center population is thinking about what do senior centers of the future look like. How can we be creatively meeting these needs, because things will be changing. These numbers will change, and we need to be moving and changing with the times. So shortly, we need to do better investments across the board. Don't be misled by the numbers saying we've taken care of senior health. We need to be working on that too. But certainly the reality of child hunger is significant, and we need to be focusing on that equally.
Another question that I think ties into that, and I think that this might go for you, Kim, is what would you recommend to an older adult program or an older adult living community who wants to do something to address childhood hunger? Where should they start? What might be some programs or some actions that they could take to help address this issue in their community?
Definitely. Well, I go back to the summer food service program, because if you are in a low-income area and there are children who have access to your location, senior centers or senior-based organizations can definitely be sites and provide that congregate feeding location, and because it's about being within the boundaries of a school that's 50% or higher free or reduced price lunch, and eligibility. And that the same goes for the after-school meals program. And so there are opportunities to literally open up your kitchen and your location to children in the community. And again, if there are programs near you that need programming, I mean, it's huge budget dollars for schools to be open during the summer and provide programming, and food to children are just continuing to decline. And so there are local opportunities to engage and help fill that gap. And so it might be that one of the best places to start is reaching out to your state agency. The winter is actually when most state agencies start to look at planning for summer. And so if there's a way to connect to existing programs, I think that can be a great way to start to have an impact.
And I'll just mention one opportunity here through Generations United. We have an initiative called Seniors for Kids that engages older adults on behalf of children. And we have a particular focus on early care and education, but certainly critical to children's ability to learn is that they're, as Kim articulated, well-fed and able to concentrate so that they can learn. And through our Seniors for Kids initiative, we have a range of opportunities for adults 50 and older to do advocacy on behalf of children. So if you are an adult, 50 and older, or know someone who is that you think might be interested in becoming a part of that network, we encourage you to visit www.seniorsforkids.org, and there's an opportunity to sign up and become a part of that network. And we regularly offer a range of ways that you can become involved locally and as part of the national network to speak out on behalf of children. And certainly hunger is one of the key issues that they'll be speaking out on.
Great. Well, I want to thank everyone for participating. That's about all the time that we have to continue this conversation today. So thank you very much to Kim and Jaia for sharing their expertise on this issue. Thanks to all of you for joining us today. On your screen and in the presentation is Jaia and Kim's email. So if you have specific questions or information that you'd like to receive, you can contact them directly. You can also contact Generations United through our website. And again, we are recording the webinar, and the slides are available at the website. So we hope that you can share the information with people who are unable to join us today. And then again, visit our website for information on upcoming learning opportunities through Generations United, and we hope to see you again at our next webinar in January. Thanks all for joining us today.